Hey there, this is KP with Coronavirus Diaries, a channel dedicated to the documentation of a world under lockdown. Today I'd like to start off by thanking those of you who have subscribed to our YouTube channel. We really appreciate the support you've given us the past few months, and if you haven't subscribed yet, please do, or please share videos to anyone who you think would get something out of this. We'd also like to thank our over 500 followers we have over on Twitter. We appreciate you watching us from over there and engaging with us in the Twitterverse. This video is going to have some good news and some bad news and some downright weird news. We're going to start off with the bad news and just get it out of the way. And it's really not news at all. We already knew that the disease is accelerating. According to the World Health Organization, COVID-19 is accelerating. We're hearing of fears of a potential second wave across Europe that is starting over in Germany. Head of Germany's disease control agency has blamed negligence for a worrying rise in cases in the country, according to this story. And as Madrid is imposing new restrictions, Germany's talking about a second wave probably sweeping across Europe soon. So that's the bad news. Now let's get to the good news. Phase 3 of a clinical trial of a vaccine for COVID-19 has begun as of July 27th. The drug has been developed by Moderna and the National Institute of Health, and they're going to be rolling this out to approximately 30,000 adult volunteers here in America. I heard that it's going to mainly be taking place in Florida, which is perfect since that's been a hot spot for quite some time. It's looking very promising. They're using a new type of technology called mRNA, which when injected, it signaled the body's immune system to prevent the infection by producing neutralizing antibodies. It's very similar to another type of drug that I'm going to talk about in a second. Here's the timeline here. So you can see they started the phase 3 study on July 27th. They also released findings from their non-human primate preclinical challenge study of the same drug, and that was published in the New England Journal of Medicine, as you can see here. And what they found was that of the 8 primates, all of them showed absolutely no detectable virus replication in their noses compared to the 6 out of 8 in the placebo group on day 2. I also read that 7 of the 8 primates had absolutely no evidence of coronavirus at all in their systems after this drug was administered. Another company and another drug that's being rolled out is Pfizer and BioNTech. They have a vaccine that they're using, a different type of technology, but similar. This one kind of works kind of like a homing beacon. It puts special types of proteins onto the virus, and our body then detects it as a disease and attacks it. So it basically is jump-starting our immune system to battle this disease by signaling our body that it is indeed a disease, since our body can't recognize it as a disease yet. So you can begin a large-scale trial of the coronavirus vaccine in the United States, also with 30,000 participants. And now on to the weird news. Kodak, yes, that one, landed a $765 million federal loan to develop prescription drug ingredients. It's going to be adding 300 new jobs to manufacture drugs in the United States, and the $765 million is going to help reduce reliance on other countries for ingredients and generic drugs. And this is pretty major. I mean, this is going to be huge for Rochester. It's going to be huge for creating jobs here for manufacturing, which doesn't happen too often anymore. They're going to be using that money to expand and repurpose their existing facilities in Rochester, New York, and also here in St. Paul, Minnesota. So that's kind of an interesting piece of news. Take it however you like. But anyway, this one's going to be kind of short. I just wanted to give you some highlights of what's going on right now. I want you all to stay safe out there, and God bless. This is KP signing off.